fairer and healthier world. The World Health Organization has called for urgent action to eliminate health inequities and mobilize action to attain better health for all and leave no one behind. Now, we want to have this conversation, how exactly Kenya is doing when it comes to, achieving universal healthcare coverage. And joining us to have this conversation is Dr. Were Onyino, who is the president of the Kenya Medical Association. Thank you very much, sir, for joining us here on News Desk. Now, as we mark World Health Day, amidst the COVID-19 pandemic, talk to us about the gaps that have been exposed, especially by this pandemic.
Thank you for having me. I think the COVID-19 pandemic in our country has actually laid bare the state of our healthcare that is not very good or something to talk about, and this has been brought about with the poor governance of the healthcare system in this country, which has resulted in a lot of inequalities in terms of access of health services to the common mwananchi. If you look at most of our counties, other than the counties around the metropolitan area, people are really struggling to get basic healthcare services. They're being asked when they go to seek care to buy basic commodities like gloves, to buy medicine. I think these are things that as a government, both at the national level and the county government, they should be able to provide this, because we do pay taxes. And one of the key things that a government must be able to provide, other than security, education, ensuring livelihoods of the population, is actually access to quality healthcare services. And I think as a country, this we have failed to do, in as much as there have been some improvement, but it's not an improvement that has actually led to sorting out the mess that we currently find ourselves in, and actually that has been exposed with this COVID-19 pandemic.
All right, and even as you talk about a mess that has been created, 2 years ago, the Kenyan government piloted the Universal Health Coverage Program in a number of counties. This was supposed to ease access to health services for millions of Kenyans. Now that this is sort of not going well, it was a step in the right direction, but perhaps due to COVID-19, the gains have been reduced. What should we do as a country?
Yeah, I think the pilot for the UHC was actually a great idea, and I think the problem was now the dissemination of the findings, where we needed to sit together as stakeholders in the healthcare sectors and actually review how that pilot that was conducted in Nyeri, Kisumu, Machakos and Isiolo went. And we could have given a recommendation on how now to move together as a country so that we can have equity in terms of access to healthcare services to all citizens of this country. So it was a good step taken by the government, but I think now the follow-up action is what has been lacking. The lack of stakeholder involvement, the lack of professional input from professional associations has been lacking. And this has actually now negatively affected the UHC agenda, which as an organization, we think it's the way to go to actually ensure equity in terms of access to healthcare services.
All right, kindly stay with me, Dr. Were. We want to take a short break here on News Desk. We'll come back and, of course, continue with that conversation on how best we can achieve universal healthcare in the country.